we've done is we've gone to each of the different, I guess, colleges. It's a little different now with the reorg, how everything kind of structures. So a couple of them we split, but to the different disciplines across campus, and wanted to talk a little bit about how open access operates in those disciplines. So we did a panel with education and social sciences. We've done one with business, one with arts and humanities, and one with STEM departments. And all of it just kind of get a sense of how this works in different disciplines. If some disciplines are more open to open access, if some have more concerns about it, just getting a feel for kind of how that operates, and kind of look at it in two frameworks for the most part, looking at the framework the publishing side and then the education side. So OER over here and things like journal articles and publications here. So the main thing I kind of want to do in this conversation is get a sense of how open access is viewed. We'll start, I guess, with the publishing side, how it's viewed from a publication standpoint, how OA journals are viewed versus traditional journals in health and in nursing, and maybe you can just kind of talk about that a little bit to get started.
You want to go first?
Well, I mean, as far as, I don't believe that we've had anybody here that has published about it. When I look through the things, just when I finally on that second link that I was looking for, nobody that I know that has actually published and added to it. We do have a lot of authors in our department, in our college too. So it would be something there. And I think probably the biggest concern would be in the past that we've had things where people get outside their comfort zone is the predatory journals.
Sure.
But as far as the things that are listed, I don't think that I don't see any of them that I really recognize blatantly that are those. So it sounds like it goes through some different channels. And do you have any of that information that you could share with us about how these open textbooks get to be available to others?
Okay, well, actually, I was looking at the publishing side first. Like
Well,
the journal
I mean,
side.
but the journals,
Yeah.
okay, but I mean, what's the process they go through that they decide which one's going to have the access availability?
So open access journals typically, it depends on how the model works. The most common model, it seems like nowadays, is an author charge model. So the author pays a processing fee, they call it, at the point of publication, to offset the publisher's costs. And as a result of that, then the publisher makes the article freely available to anybody. So anybody can go to that journal and download that article without hitting a paywall, without having to have a subscription. So,
Well, I know that there's like some hybrid models on that. And as far as like, it's very difficult. I'm with nurse anesthesia, and the academic community is somewhat small. And it's very difficult for us to be published in nurse anesthesia journals. I don't want to say that we're not the only profession within nursing that depends on this hard science.
right.
But their standards are very difficult. So I can see, if you have information that you feel like would be useful to others and you need to be published, I can see where that would be, that would be great for us. But I just worry a little bit about the standards. I know that you can go look at the impact factor of the journal and things, but I worry a little bit about depending on that. I don't know, sometimes I kind of view open access almost like Wikipedia. I'm not real sure what the standards were for this journal available on open access. You see what I mean?
Yeah. The things that you're ideally looking for when you're evaluating journals, even in open access, are the same things you'd be looking at in a print journal. So you're looking at an editorial board. You see recognizable folks in the field that are part of that editorial board. You're looking at the review process. Is it peer reviewed? Is it blind, double-blind peer review? How does the peer review process work? If you see those things in place and those things all kind of check out and look good, then in that case you're okay with going with that journal just like you would be with a print one the same way, because quality can be an issue either way. The bigger concern, of course, with quality with the open access journal is that if you're paying that fee at the end of it to publish, then you want to make sure that you're publishing it somewhere that is reputable. Whereas if you're publishing in a print journal, you're not out any money if it ends up being a low quality journal. You're just out the time that you invest, which is still not a non-negligible thing. Let me be clear about that. But Oh, a good resource for that, if you look at, it's Think, Check, Submit. So if you just look up that website, it kind of gives you a list of criteria to use when you're evaluating journals. So here are the things you should look for in determining, is this a journal where I should submit? Is this a quality journal or is it not? And so that's just a good, handy resource to use. Yeah, because one of the things that I've sort of thought would be a bit of a tension in this field especially is, on the one hand, if you are doing research, if you're doing scholarship that could have practical effects in the field, like the actual practitioners could use to improve their practice, to improve their treatment of patients, you want that in their hands, hopefully as easily as possible. But on the other hand, if some of the more prestigious and the more, I guess, esteemed journals are still using the subscription model, and if that's what you're using to base T&P criteria on, for example, then you have more pressure to publish over here. So it's like, do I publish here to satisfy my own professional needs to get tenure? Do I publish over here, which means more people have their hands on it, can access it and use it? And I could see that being a real tension, is there how to resolve that I guess, conflict in a sense.
And I think a lot of what we do too, I think it kind of depends on what portion of nursing you're talking about, or health. I guess we're representing all of the healthcare fields.
Yeah.
For example, policy. I'm very active in health policy. Well, by the time those things go through a journal and go through all those things, and the information is 5 years old by the time you see it.
Yeah.
Well, the Affordable Care Act and our response to that changes day to day.
Sure.
And with each congressional cycle. So it would be great to be you're talking about tenure, standard subscription journal versus getting it into people's hands.
Right.
I can see where maybe in that instance, and clinical simulation, case scenarios, things like that, DMP projects, that may be a better route for the open access. That's just off the top of my head.
Okay.
And some of our, just our DMP projects, they may have small numbers, so small participants, so
Sure.
We're not going to have the strength that a huge one would have in it, but yet they all have had this last round. We did a model differently, where instead of individually presenting on a trillion different days, we had one big scholarship day.
Okay.
So we had a lot of information flowing, a lot from us, listening to them, hearing what what their outcomes were, and either a collective or together, like as an event that you could publish, or either subtopics could be done just to get that information out there, because what they're looking is asking clinical questions to look at practice change. You wait that 15 years, our equipment's even different. So if you could get it out there quicker, it could be a mechanism. Once you get it started, then more people might be a little bit more prone to go ahead and say, okay, well, this might be, this open access could be a great sharing that you could do with it.
Yeah.
But again, you said you're talking about the tenure versus, what's the purpose?
Right.
Is it T&P, or is it dissemination of information?
Right, yeah. And that's kind of been one of the overarching questions that's come up time and time again when we've done these things, that question of who is the audience? Who is our audience when we're doing this work? Is it our peers for the professional side? Is it the people in the field? Is it, the public, depending on what discipline you're talking about? Who is the audience? Who is this that you're writing for? And how that all plays into this too.
Mm-hmm. I looked through on some of them before, because we have levels from our first semester undergraduate student that comes in. Each level has new things that they learn, but some of the ones that are coming in with no history, they're learning from step one, how to do everything. So they have, some of their classes are procedural type things, and then you practice it with a lab to learn and do it. And I looked through to see, was there anything really that fit? There would be some articles that could possibly fit, but there were no manuals yet for that were at least in the one that were there. So I think it would depend on what level, but yet some of our other students that would have policy, that might have something to do with some type of particular change with initiatives that were going on, whether it's things from CDC through antibiotic stewardship, things in our hospitals, our metrics that are coming down. that they easily could be linked to something on there and get it out there faster. So depends on what the learner is. And I think the sub part, because within health professions of our college, we've got all a lot of variety of our disciplines. So there may be something that somebody's there now I just happen to look too, and there's like 4 for disasters and emergency management. And some of them, when I'm looking at them, it's some national institutes that their information has gone out as opposed to an author. It's done it from that. And then international journals of like disasters across 20 years. So there could be some things that could be a reference if someone was doing for disaster preparedness, but when we look across everything we do, there's still a lot of areas that things can be done. Now, if you're talking about putting together something, that you almost like put together your own textbook from articles and from media sources, that might be different, but that's not the way that I'm understanding. Is that part of what? I thought you would use something that's here instead of what you have, or is it more that you can make your own?
So the textbook program, basically the way we do ours is it's a 3-tier model. The first tier we do is we call the adopt tier, which is just you go get a ready-made, out-of-the-box, basically open textbook from something like OpenStax, for example, and implement that in your course in place of the traditional textbook.
Mm-hmm.
The second tier, which is kind of what you're describing, is that modified tier, which is where you sort of build your own open book out of a variety of resources. That just variety of free resources, I should say. And that includes the resources the library has, which technically aren't free because we're paying for them, but they are free for the students, which is kind of why we include those also.
Mm-hmm.
And so you could pull like some articles or some, if there were some open manuals, for example, or things like that online that were freely available to students, you could incorporate that in there. It's almost kind of like a course pack in a sense where all the resources are free. One of the faculty members on campus refers to these as a Frankenbook. But so that's kind of how that tier works. And then the third tier, the create tier, is that you actually creating your own open textbook.
Because I know we were highly discouraged from doing the create your own custom textbook.
Okay.
Where the front was, here's your syllabi, or syllabus, whether it's allowed, and of course, here's your all your activities. And when you think back where we were then, some of that was before it was more common for you to have your own shell. There was a time when you really just put your grades up on the shell and nothing else. Do y'all remember that? No, see, y'all did, sorry. But we just put the grades up, and then you were paying $20 a course. Then they were making you pay for just having your grades up, and then suddenly we just like within about a 3-year period we were moving most of our things on. All our syllabus, all of our modules and things are online, and then online testing, and all of ours over here, y'all are doing all online testing.
Mostly.
Because we're on undergraduate, we're all online
Okay.
testing completely. In fact, we just got a new product licensing that's separate from campus. So it's all, they get a little scratch paper, and that's all they have to turn back in whenever they finish.
Josh, I wanted to ask you about the publishing. You're more familiar with this open access across the different disciplines here. Are you finding that this is a place where people are publishing their literature reviews? Because I know a lot of times, they don't follow through with necessarily publishing their dissertation, or are you finding literature reviews there, or is that not something that?
Somewhat, maybe. I mean, most of what we're looking at is sort of original research, things like that. So research articles, things of that nature. But now, one of the things about open access that is nice is that it is a way to get things out there. Do you want to talk about great literature?
Yes.
So things that don't necessarily fit into, that is something you definitely could publish in open access format. So things like that could go in Aquila. Aquila is the institutional repository that I manage here at the university. So things that maybe don't fit in traditional pathways of scholarship, but still would have use for people or for researchers, then you could get that out there that way. So, I mean, things like that could certainly be.
Okay, so the green is the not peer-reviewed,
Okay,
there's
so
green and gold, right?
Right, yeah,
Okay,
so
the
that
green.
actually depends on the model. So green
Okay.
means it's published in your traditional subscription journal, but you're allowed to put a PDF of that article in the repository.
Okay, okay,
And it's generally the PDF that they let us upload is that final version before the journal applies all their formatting. So after all the review's done, that last version you send to them, they'll let you put that in the repository. That's great. So there's no fee associated with you doing that, right? That's just them saying, okay, this version you can put in the repository. It's not going to be that final version with our formatting that's actually in the journal, but it's essentially the same content. The gold is where you're actually publishing the final version in an open access journal. And that's typically where if you're going to have the author fee, it's going to be gold open access, where you're paying the author fee and then that article is freely available from the journal website to everybody.
I could definitely see where there would be some value in having literature reviews, if you could get to them that way.
Yeah.
They scour the literature for a focused part of it. And then some of them, we've had some group ones, so they'll do some group things. So in that group, instead of, they've got one core that's the central content, and then basically all the little sprites around that relate to it. It might be cost, it might be obstacles, barriers. I mean, there's a lot of different, I can't remember, we had that one that had 4 or something. But there was some that looked at clinical practice guidelines and around. So but it was only the central one. So if you got hold of that literature, you could really go from there to say what else is out there.
So how are those typically being disseminated in your area?
They're really not. I mean,
Okay,
the literature review is folded into to the final document, and I think they call it like available knowledge in the SPAR 2.0, which is what we're using right now.
Okay.
But a really good literature review is worth gold. I don't mean to say green and gold, but it's worth gold. I mean, it is, because someone has. I don't see a problem with that, because everything you say in the literature review has to be referenced. It's not no synthesis really.
Yeah, well, I mean, as long as that's not something like that's being published with some publisher where they're getting copyright to it, then absolutely we could put those up in Aquila without a problem. So yeah, just let me know, we could.
That would be extremely helpful, I think. Are you guys researching, or have y'all started doing anything like that? Looking at literature reviews, or?
So we do quite a bit. So most of the journals in Garfield are open access, freely available. But I guess that's part of librarianship of wanting to disseminate knowledge to everyone.
Oh, absolutely.
But literature reviews are definitely a part of that, and bibliometrics and those sorts of things are part of our core literature for sure. I did have a question for you on, you mentioned the testing software that students were using, they had to pay a license fee.
Well, the school pays it.
Okay, so it's not,
So, and then it goes into fees.
but it's like a part of the course fee, or is it a separate fee they have to pay?
I think it's a separate per person.
Gotcha.
And it's for like every semester. They will, but it doesn't, there's a few of the places that have like the proctoring systems. It's every time you take a test, and the one we're using right now is not that way. So it doesn't matter how many, if you're taking a quiz, if you're taking a test, it's a flat fee for the semester. So I think they must know how many users within the undergraduate program that there are total, and then that must go into determine how much it is.
Probably based on FTE or something like that.
And we've just started that one since school started, right after school started. So it's really new.
Okay. I guess sticking with that theme then, the open education piece, have you had a chance to look through some of I know you mentioned you looked some of the subject, or the OER guide that one of the librarians made. Have you seen some possible applications from that in?
The one for the disaster, we've entertained having like some elective courses, and I think that one could be good. But as far as like, especially our brand new students coming in, they have a variety of courses that they take. And within them, there's some specific things that they're starting to do: professionalism, pathophysiology, assessment, and then sort of introduction to practice when they're learning starter, fundamental, interpersonal communication and skills. And so I did not see a good fit for those.
Okay.
But there could be some of the professional courses, even patho, depending on what it is. But it's very, they take as a prerequisite anatomy and physiology, but this is moving this forward. What do you do with it? What's, here's the problem, things with how does it work with it now if something's normal or abnormal?
Yeah.
What do we do with that? And so they're more specific with it. And then you have one on your level that's even more specific for.
Well, we do. In the profession of nurse anesthesia, when the education is completed, you have to sit for a certifying exam. And that exam is based on a core group of textbooks. So we're pretty much tied to that to teach from those textbooks. Now, that being said, there, you know how politics works, okay? There are some very foundational, fundamental textbooks that are wonderful that the National Certifying Board kind of cut out. But we still will utilize those in addition to the ones that they have based their test on. But we really don't go outside of those that much, just because, the students will be held to that standard at the end.
Sure, yeah.
But there are some, is talking about opportunities. We were at a meeting yesterday and talking about the intercession and some course offerings. I can absolutely see from the textbook list that you could use some of those in some of these intercession courses that people are developing. Nursing informatics, things like that. You could pull from those textbooks real easy. And those would, that, like I said, those wouldn't fall in line with what the students would have to have, but could be offered in addition.
Yeah. One of the things that we really are trying to emphasize, for a couple of different reasons, but we're really trying to see if we can sort of target some of those intro-level courses, some of the early courses that students are taking, because those are great candidates for transitioning to open for a couple of reasons. Number one, it's going to affect a lot more students because a lot more students have to go through those classes. So say an upper division course that maybe has 10 students in it, saving 10 students $100 on a textbook versus saving 50 students times 10 sections in an intro course, that same amount. It's a huge difference in terms of how many students you can affect. But also those intro courses tend to be a little more general with the material, so there are, number one, more readily available resources out there that you can sort of incorporate. And number two, because of the fact that they're more general, it's easier to sort of build something out for those too. So I mean, we certainly welcome people both at the upper levels and at the intro level, but those intro level classes are a big point where we're really trying to target and get people at that level involved, and you can have such a big impact there.
And see, here in the undergraduate, they start as juniors. They actually start the program. And then your program's 3 years long. As a graduate, that's a BSN to doctoral degree. They finish. And then in between, we have the master's program for the nurse practitioner, but that is possible from a BSN to a master, but we also have BSN to doctorate within it. So it's all upper level to get very specific.
But I can follow your reasoning. I mean, I think that's good. I think
Mhm.
that's great. It'd be great for the students.
Yeah.
Well, and then so many of them, they just even for their general courses, will say they'll pay $600 or $700
Oh, yeah.
some
Yeah.
semesters.
So yeah, that's one of the big goals in doing this, is trying to find ways to save the students that money. If there are comparable resources out there that can be used or developed or whatever the case may be, that the students could use that would be way, way, way cheaper, then of course we would encourage that, because I mean, it really benefits them in a few different ways. Number one, you've got the availability of it. They don't have to go out and buy the thing. It's available on day one. They're not sitting there waiting 2 weeks into class for their student aid, their financial aid to kick in so they can go buy the thing. They've got it from day one. So everybody's got access to it. You've got what we encourage our participants to do is to make these things print friendly, because some students still want like a physical book in their hands, so to try to make it in a format that the student wants to print, they can still print it, they can mark it up, scribble on it, whatever. If they want to read it from their phone, which some of them do, which kind of baffles me, but that's, if it works for you, then God bless you. Then
Do you have
do it
printed
too.
copies housed in the library, or is it all electronic?
The open ones we have, we just house the electronic copy, and then they can print it certainly if they want to. What I'm hoping we can do if we grow this thing enough is to kind of make it, reach an agreement with the Image Center here on campus to let them print them at cost, basically, that way. So that, because then it's still way, way, way cheaper than the $150 textbook that sometimes they're buying for these classes. And, across the board, we found the faculty are certainly aware of that, and they're receptive to the burden that is placed on students with that, and if they can find cheaper alternatives, they're happy to. So, in some cases, you can get away with that with things like a rental or buying an older edition, for example, which is somewhat better, but that depends also profession to profession. Some disciplines, those subsequent editions, very little is changing. Other professions change pretty rapidly, and so you always kind of have to stay with that current edition because of all the changes. So one of the examples, when we had the business panel, one of the faculty members there talked about teaching tax code. And the tax code changes all the time, so there's no way they can avoid the book there because it's changing basically every year.
So that would be a better one to do than open, is that what you're saying?
So that would be one of that case where they almost have to do a traditional textbook because they can't keep up with how quickly it changes to update the material themselves. They almost are dependent on someone else to do that.
It's almost easier, I would wonder if it's almost easier just to have something that you do yourself.
Yeah.
The federal.
I'm an accountant by osmosis, my husband's an accountant.
Okay.
They like wait on that tax book to get in every year. I mean, that's like, and it's very expensive. Very expensive.
Yeah, I think she said that theirs is like, I think it's like $300-something bucks. Yeah.
But I've known, there's been faculty before that have made their entire course using journal articles that were, just things that were readily online. It's just when they made their modules up for each week, they did it focused for that. You might have 5 or 6 articles for that one module that you would do, and then you'd move on and have something, because it just wasn't, some of our courses, as they morph a little bit, we're in a different mode than the publisher is.
Yeah.
So, if you're getting something that's more specialized or more focused for whatever the need is, they're not, you really only need maybe about half the book, but you may have to buy the whole book.
Exactly.
So, they looked at the articles by similar, that are some of the authors or even whoever was the people at the time that was the best fit, and located enough articles that they didn't have to buy a book at all.
Yeah.
So Josh, do y'all buy these? In the library, do you select which books to buy? Or do you just pay into a system where you get access to all of these textbooks, or?
Well, I mean, the open textbook, the whole benefit there is you're not having to buy those at all. They are freely available.
But it's electronic.
Yeah.
Yeah, but I mean, I guess I'm just not familiar with how this part works.
Okay.
At USM, do you guys choose which ones that you want to put on this, or is it just every textbook is available to everybody everywhere for free?
Okay, so you talk about which ones we fund, like through our
Yes.
program? Okay.
Yes.
So there is an application on the Provost website. If you go like the Awards and Endowments link on the Provost page, you'll see the link to our application. It kind of explains the program, the qualifications, and has a link to the application form. So, but essentially what they do is they submit the course they're planning on submitting it for, how much the current textbook costs, how many students take the course in an average year. There's a letter of support from the director, the chair or director of the program, and probably a couple other things I'm not remembering just off the top of my head. But they basically submit that, then we have a little committee that reviews the applications each year, and based on however much funding we have available, we'll select the ones that are stronger, that meet the criteria, and we'll try to fund as many of those as we're able, and go from
Okay.
there.
Okay. So this list that you have is constantly being added to?
The ones on Aquila?
Yes.
Mhm, yeah. Now, there are lots of, like the ones on that subject guide material, again, a lot of those are done by other places. Those are freely out there. You can go grab those right now. So that would qualify as like that adopt tier that I mentioned for our program. So if you were going to go pull one from, say, like an OpenStax or I think Merlot or any of the other places that are on that list, and just kind of take that ready-made book that's already done, that's free for you, and use that as the assigned text for your class, then I'm sure you can do that without a problem.
There's this one that came through that's the statewide call. Is that different from just the university's call?
It is, yes. That's the one that is anchored in Ole Miss, yes. Yeah, we, well, no, we encourage the faculty, either one, we tell them if you can get theirs, they have more money than we do because they've got a big funding agency behind them. We've just got some campus funding, which of course isn't as significant as theirs, so.
See, they've got Yale courses and Elgin courses and MIT, and so a lot of different things.
Yeah, in fact, we opened our call the day after theirs closed to basically say, if you missed this one, here's the second chance kind of to do the local program. And so, yeah, I've actually co-presented with the librarian at Ole Miss that helps to facilitate a lot of that program. We've presented together at a few conferences around the state and talked about the benefits of both. But we see them as complementary, not competing goals. You know, we're both working for the same goal, which is making these resources affordable for students. So if that helps us get there, then more power to it, we say. So.
Where do you think this is as far as when you get the license, how long are they good for? I mean, are you getting a license, or is it once you get it, it's there until there's another edition? How does that work? Okay,
so basically when the books are being created, they're being assigned what's called a Creative Commons license, which basically outlines how you can use that material. Typically, the open textbook is going to use a Creative Commons attribution license or a CC BY license. And what that basically means is you can take it, you can use it however you want to. The only condition is that you attribute that it came from wherever. So if you're going to use an open textbook off of, say, OpenStax, or you're going to use one off of Aquila, you can change it up, you can kind of pull parts of it out, add some of your own stuff, as long as you cite this was adapted from this textbook at this location. So this was adapted from, make something up, so Chemistry 101 textbook at Aquila. As long as you attribute yours when you do that, then you can use it how you want it. That's the license that it's used with. So, it's the whole idea as people create these is they're creating them to be used by others also. It's not just to be at the one institution kind of boxed in like that. But I mean, it's good exposure for a faculty member as well, right? If you write a really good open textbook that gets used in all these different institutions, that's some good exposure for you too. So.
Do you see that, foresee that there's going to be like additions, like just like you do a book edition?
Sure, yeah.
That things are going to be done every 2 or 3
Yeah, because you can
years?
update, the difference with an open textbook is you can update that as often as you want to. And so you just would generally kind of add in the new additions along with, I don't know, I know OpenStax does that, for example, and they do new additions on a pretty regular basis. But what you can do if you have concern about that is you can just kind of download that PDF version. So if you want to keep using that same version and not worry about, oh, a new edition is going to come out that's going to change all my, say, the problem numbers that I'm using or all that, and you just grab that PDF and say, this is the version we're using. If you want to go check out the newer version for your own purposes or just to kind of see some of the things there, then you can do that, but this is the one that we'll use for any exercises or problems or for page numbers or whatever, then this is the official version we use. And you don't have to worry about that, and that really comes in handy again for those disciplines that don't change much, like some intro courses that are going to be pretty static, where that new edition is not really changing much except maybe some of the exercises are a little different. Then you got to go through and update all your materials with, okay, now it's the problems 1, 2, 4, 7, and 9. We're doing problems 1, 3, 5, 9, and 11 or whatever. So it eliminates all that. So. It takes some work sometimes on the front end in terms of finding the resources or maybe putting something together, but the payoff comes in the back end because you have that stability of knowing you don't have to deal with something constantly changing unless you choose to change it, unless you see, okay, this doesn't cover this part of the course enough, so I should beef this part up, or this part is unnecessary, I can take this out. So.
What other, I know you've been visiting the different campus, the different disciplines within campus. Besides the lower level courses, how other ways are people using this?
We actually, a fair number of the applications we've got in our program have been for upper level courses, for example, but, which has been kind of interesting. But probably the best example, well, there are two examples I'll give you. One that is a lower level course and one that's upper level. So the lower level example I'll give you is college algebra. Right now, a group of faculty in math are creating a brand new open textbook for Math 101 and the Math 101 lab. And they've kind of redone that structure so that now those are kind of co-requisite rather than having the Math 99 prerequisite that was there before. But what they found in looking at all the different textbooks that are out there, none of them covered the material in the sequence that they had found most effective for the students. So what they ended up doing was this sort of jumping around pattern where you're doing section 1.1, 1.2, down 2.3, 2.5, back to 1.6, so on and so forth. So what they've done is they just basically built their own textbook that covers the material in the sequence they have found to be most effective with the students. And what they've been able to do is take what was a $130 textbook and remove that cost altogether. The only cost that the students will have is they found an open math homework module that does have a little bit of a cost, but it's I think like $25 for the course, which is anything less than $130. And it's done by Lumen Learning, which I think is one of the sponsors of that grant program. And that fee is basically only for the support, the technical support. So if something breaks with the site or something goes wonky, and there's somebody you can contact 24/7 that can help you troubleshoot that or whatever. So you don't have to worry about a student, say, doing their homework at 11 o'clock at night when something's due at midnight, and then something goes down with the site, and they're trying to contact you. You don't have to worry about that. It's the support that's handling that. So that's a worthwhile thing for them, and still significantly less cost for the student, over $100 per student less than it was before. So that's one example. The other example, we've got a criminal justice faculty member, Dr. Alan Thompson, who is actually doing his second open textbook with us now. He's taken two of his upper level criminal justice courses and created open textbooks for those that he's heavily supplementing with some free resources, with some a lot of library resources to kind of just build out his own textbook from that, because he was one of those who looked at how much the students were paying and just thought, well, this is unnecessary for students to have to pay this much. If there are other ways that I can deliver this information, then let's do that. I mean, one of the things he said was that I didn't realize that I could not technically assign a book. I thought I had to assign a book. That's why I found this was an option. Then he was immediately interested. And so, like I said, it's been successful enough with him that he's now going through our program a second time doing another textbook. So
Once they create these books, are they available to anyone or just those students?
no, they're available to anybody. Yeah, they're on Aquila and they're open for anybody to look at, to download, whatever the case may be.
Even that homework module? Or is that just something that the students have to pay for independently?
Yeah, that's a separate thing.
Okay.
But because it's
Okay.
done through that Lumen program. Yeah, but the textbook they're doing, that will be open to anybody.
Don't you already also see textbooks for like upper level courses that are so specific that there's not an existing textbook?
Yeah, yeah, that's
going through.
going to be commonly the case where you're going to get into that create tier, where they're just going to create their own because there's not a lot of stuff already out there. And really, that's a good service opportunity as well, because if you create that resource, there's not something there already, then that becomes something that's helpful for other people that are looking for the same sort of thing. They find your book that you've made, if that's the case. And so, yeah, I think that's definitely true, that as you get into more specialized areas, there's not as much there, so there is more onus, I guess, to sort of create something that meets that need.
And there would definitely be, I would think, an opportunity from case scenarios, clinical simulations, that sort of thing, because those are very hard to find for us.
Yeah, so some of it could even be,
Like grand rounds. Except we just got to de-identify everything, that kind of thing, that could be useful. If you can't find it now, it'd be useful to have it. Because our child usually make them do presentations as seniors and they have to lead it, so that if they had to turn something in, that could then be done. So what do you do if you have like multiple authors or student work, or is there special things that you have to do?
The multiple author bit wouldn't necessarily be a big hurdle, because basically the way copyright works, basically that if co-authorship exists, then any author can act on behalf of the other authors. Now, generally, best practices, you want to try to not just act unilaterally. You want to kind of loop your other authors into what you're doing, but technically you wouldn't actually necessarily have to. Student work, the only thing there would be just for FERPA purposes, if there's something identifiable, you may want to kind of strip that out if possible. So there's something identifying specific students, unless it's something that is that they've sort of specifically signed off on. So for example, like theses and dissertations, they have to kind of sign off on this paperwork, so that kind of gives them the clearance to post that sort of thing. So either just have some acknowledgement from the student saying, I acknowledge that my work will be public in this way and I'm okay with that, or either just having something where it's anonymized student work, then you'd be okay.
And what we're referring to is the third year of the nurse anesthesia program. We have our students basically bring us in a case that they've performed, whether it's at one of our clinical affiliates, and it's basically taken all the knowledge that they've learned on a cellular level, anatomy and physiology, differential diagnosis, and then how they treated the patient, what the response was, and maybe there were some opportunities that things could be done differently. And they do that sort of thing. I could see that we could really put that through. If I were a student, I would want to read previous years to see how they handled that.
Especially because you include the opportunity. It's not just what happened, it's what could you do different. So
So that's absolutely something we could. I do that same thing when I'm talking to prospective honor students. I tell them, hey, the honors theses are on Aquila. If you want to go look and see what one of these things is like, what goes into one, here's a chance to look. You can kind of see what kinds of research the students are doing, what goes into that. The same thing could be true for these. I could definitely see that being a good application.
Think about that, because it starts off under low and it goes on up. There's something in these, the main grants you're talking about are the ones through USM Library, and then the one with, this one's budget OMS. Is that the main place that you see places that help fund these?
Yeah, that's the main two in this state right now would be those. The Ole Miss one and the one that we're doing locally.
Is there any, when you get this grant, does it also have assistance with instruction to whomever the author is?
Ours,
workshop kind of thing?
yes, ours does for sure. I think the Ole Miss one does as well, but I can't speak to it as well because I haven't gone through that program. But ours includes 4 workshops. There's copyright, there's just an introduction to open textbooks, there's a workshop on where to find resources, and then there's a workshop that just experiences and lessons learned from other faculty who've already created textbooks themselves. And then each participant in our program is partnered with one of our research librarians, generally the one in their subject area, that can help them with finding resources, that can help them with things like that. So they do have that layer of support to help them through the process also.
What's the time period of that? Is it a semester or?
It is, basically, it's about a year.
A year.
So the cycle will end, the end of this year, by the end of this year, we'll announce the recipients. Our deadline is November 30th. We're taking applications till November 30th. We'll pick the recipients there in December before we leave for the semester break, and they'll be notified so they can really start from January on. And the goal is, especially for the tier 1s and the tier 2s, to implement in the fall or the spring if the class is only taught in the spring. But so to implement by then, we've got some flexibility with the threes, because creating one takes a lot of time, and we understand that, so if that needs additional time, we can work with that, but so you're looking at about 9 months to a year, depending on whether it's for a fall or a spring class. And we try to do, about every couple of months, we try to have like a meeting with all the participants too, so they can bounce ideas off one another, tell what struggles they're running into with doing stuff, and kind of get ideas from one another, and just have that cohort to go through the program together with as well, so. So you've got your librarian, and you also got your colleagues that you're doing the program with, along with you.
Are y'all projecting or looking to have a certain amount, like one from every discipline? Or what is your, say, in the next 3 years, what are you hoping for?
Like I said, my biggest hope, just because of the impact, is to, and we do state that application, we do try to put extra emphasis on submissions for gen ed courses, the intro level courses. But I mean, so my big goal is to get more of those on board for sure, because the impact is great. It's so great there, but just really getting more people aware and more interested in this would be my biggest goal starting out, because we average, the first couple of years we ended up with, I think, 3 applications was all we got. Last year we had 6, which was great. Actually, we had more than we could fund, which was a good problem to have, but also you hate to have to turn people away also. But so I would love to see, like you're saying, I'd love to see more submissions across various disciplines. I'd love to see just more people aware that this is an option. Because I think there are people on this campus that are just like Alan Thompson was talking about, that they don't even realize, oh, there's an alternative to what I'm doing, that I don't have to assign the students this book that I feel bad about assigning because it's costing them so much. And so just that awareness and getting more people interested, it would be, I'd say, my biggest goal. And so if they get interested and they apply for that other grant instead of ours, that's great. If they're doing it, then they're doing it, right? So I certainly want them to participate in our program, but at the same time, even if I can just get people aware and interested and start thinking about it and maybe starting to plan for how they can do that, that would be a win for sure.
I could see it for some of our, in nursing undergraduate, see it in some of the intersections, because you've got a specific thing, but if you can pull from a lot of different sources, and you've got a short period of time, so you've got to be very, very focused, so you would just be getting just the things that you need.
Yeah.
I could see it used for that.
We actually had a couple of years ago, we had a nursing faculty member who was going to do one. It was kind of like almost like a professional communication manual of sorts for nurses, and she didn't leave the university, so that didn't come to fruition. But that was at least an idea that she had, was to do that as sort of a way to sort of beef up the presentation skills, the writing skills of nurses. And so, I mean, something like that could even be useful maybe. So, I mean, I certainly think there's some applications that are even in this field, even with the understanding that just, that there are going to be some texts that you just can't get away from because of other requirements and things like that. But
you could, I came in here with a very different opinion, so I appreciate all the information. You could create almost a supplemental text to the required.
Yeah.
Instead of pulling from all these different places, I can see the value of having everything in one.
Yeah, you can have like just one volume that kind of pulls the important info out of those different, yeah.
So where we would pull from, like you're talking about this third tier about creating your own, you would pull from what is available already.
Yeah, you're using that, you're building on that foundation. So the difference really in the 2 and the 3 is you are supplementing the 3 with some original work as well, if it's just the descriptions or whatever. But yeah, you're not expected to build every single resource from scratch in the 3. I mean, like the one that Alan Thompson did, he's writing some introductory narratives for each section and then kind of pulling in various resources that they go and look at and read or watch or whatever the case may be.
But the resources that he's using to pull from are ones that are currently available electronically?
Yes.
Is that right? Okay.
Yeah, they're available either for free or they're available through us, through the library.
Okay. Okay.
What else do we do?
This has been more educational for me than.
Well, good.
Oh, I'm sorry.
And hopefully you'll, help us spread the word amongst colleagues, or, I'm happy to come talk to others as well, so just, let me know if there are others that want to come and you have me come and talk about all this, then I'm happy to do that too, so.
Okay.
But I think that's pretty much the big things, and I know we're also a little bit over time, so I don't want to take up you guys' time either, so. If y'all need to, if y'all need to be somewhere else, then that's great, or if you have other questions too, then, I'm happy to take those on here also, so.
Is there anything that we have to do that says we are doing, that we're downloading and using it for this purpose? You won't click through one of them, like,
Okay.
I clicked one and I knew it was from the CDC, and it's in lots of different things, so it's the same exact one that's on CDC. That's what it is, But do we have to let the open access people decide there know that that's what it's from?
So something like that's generally speaking like if it's a government publication, those are going to be in public domain too, so that you're going to be in good shape with those. There are things that are freely available on the internet that are still under copyright, so those you would need to treat appropriately. So you can link out in a lot of cases to those things. You can't embed those because, of course, they're if they're copyrighted, you can't just like slap copyrighted material into the book that you build. But
This one's copyrighted through FEMA, so do you just
Okay,
release
so-
it? Well, I just didn't realize that, but everyone clicked through it did. Do you end up just releasing the email address to the student? Is that what you tell them?
the URL, you mean? Yeah, you would just,
Or do you direct them to the library site and say, choose this book? What, I mean, how do they know what to do?
you would just be including that link to the resource in whatever you're developing, whether it be a 2 or 3 that you're linking to it. Because as a general rule like that, just linking out to content that's copyrighted is not a problem because it's going to be wherever it is, as long as it's not like something pirated, of course, then that can be. But even then, generally, it's going to be the pirated site that's going to be liable, not you for linking to that. But if you're linking to like a resource like that that's on, say, the CDC website, then that's totally fine. Where you'd get into issue would be if you just copy pasted chunks of that thing and threw it into a PDF and said, hey, read this, because then you would be taking that copyrighted material and using it in an inappropriate way.
But as long as it's referenced and it was available to you, then you can do that.
Right, yeah. Just the one thing to just be sure of is, and do this periodically, is to check and make sure that if you are linking out something, those links are still accurate.
Is there any, I know that with one of our previous, I don't know if it was Blackboard campus, you could just go to one area and hit a button and it would tell you whether it's all working or not. Is there anything like that to the library side we can do?
Not that I know of offhand, but one of the things that you might be able to do is, you could certainly take the book or the resource that you made and embed that into your Canvas shell. And so you might be able to use that checker within Canvas to do it that way. Yeah.
Some of these just have initials by an institution because when you look closer, it really is a government agency. It's just bringing them all out.
I can't think of anything off the top of my head, but there is a freely available checker
Oh, nice.
out there. I can't think of what it's called. But a Google search would bring it
Now,
up.
this says Open Learn through Open Learn University. Just one of the ones I clicked.
Okay.
And it's like a course is what it is. It's
Okay.
a course within it. It's like tracking progress, make an account, all this kind of thing. So they would have to make an account, just whatever the course requires, whatever this says this requires.
Yeah, I mean, I'm guessing, so we just, not, just kind of guessing on top of my head, I'm not sure without trying to look into it, but.
Science, math, and tech is what it is.
Okay. But like I said, that guide gives you a good starting point on some of the different places you can look for resources, for sure.
Okay, yeah. Yeah, this is like a STEM site. So let's have that. Let's see, it's 9, 12. It's like 8 pages, there's 12 courses on each page. Yeah. I don't know what level it is. It says science and allied health. That's what I think high school is. Well, this was, something that I don't think we fully understood by any means.
Well, that's good then, so.
So thank you for doing that.
Actually, that was one of the reasons I wanted to do this too, was also to kind of tell a little bit about what we're doing, kind of our side of the equation and things we're working on, so.
Well, I appreciate you keeping the students' finances in mind. I know they do.
Yeah. That's one thing I really still hope is that we can get the students more aware of this. 'Cause I don't think a lot of them realize that's an option. I don't think they have a real appreciation for the fact that there are open alternatives that could be used in classrooms. I think if they knew it and the faculty knew it, I think that both would be receptive to it in a lot of ways. So like I said, pretty universally, when we talk to faculty, they certainly appreciated the burden that puts on students. You know, the hurdle in some cases is just the time that it takes them to put together their own open resource. But so.
So we need to let some other people too know about the deadline, November 30th?
Yes.
So let them know about the deadline.
Right, for sure, yeah.
I think because they may not fully understand what was going on with it, and they may have just wanted us to look and went on.
Right, yeah, yeah.
So we can let them know in department meetings too.
And we welcome group proposals as well. I think that's in there. I don't know if it was in the announcement that went out, but it is, I think, in the program details. Because that math one I was talking about, there were three faculty/staff members together that did that program. So it's not just one person doing that entire book. So splitting that workload up can be, it splits up what you get in terms of the grant, is the financial part of it, but splitting up the workload could certainly be worth it too. Because
Sounds good. Well, I'm gonna have to run back upstairs. Thank you. And I know we can do it on our department level too. And both of them, to let them know that this is out there.
okay, yeah, absolutely. And you know, if you or they have questions, then just send them my way, and we'll be glad to help you out with that. So.
Okay.
Sounds good.
Thank you so much.
Sure.